The best way to avoid foot and ankle injuries includes wearing the proper footwear and, of course, warming up before various activities. But if your feet hurt or you suffered an injury, Dr. Nathaniel Alabi with Texas Heart and Vein Multispecialty Group walks us through some options from orthotics to surgery to take care of the problem. Dr. Alabi, a lot of people forget that the foot and the ankle is kind of the workhorse of the body. You know, we put all that pressure on it. When it goes south, then everything is shut down, our mobility. So you have a $100 off custom orthotics. Who should wear orthotics?
It really depends on your activity of daily life and your foot structure. So everyone can get to a point where they could need orthotics. Orthotics can be preventative, and the best thing is based on your foot structure. So you can have people that have really, really high arches in their feet, like this here, right? So this isn't what we call a normal foot structure. So this would be someone who would need them more than others, right? To offload certain pressure points and to also support your foot. And even people with flat feet. Flat feet are more common, and these people with this type of structure need more support due to the hypermobility, more mobility offered in a foot that is have a flatter structure. So these are a couple of custom orthotics. Just an example here. This is a full-length one from the rear foot all the way up to the toes for a full corrective device. And you also have one here too, if you can see like the different materials based on need, accommodation. Some people need more comfort than they need correction. We're able to address all those needs with custom orthotics. So I definitely think it's a good option for most people.
Yeah, and obviously the right shoe gear when you're running. I decided this is probably not working for me right here in the running department. But
for sure.
The other thing we need to keep in mind is if you've had a prior injury, I know sometimes we'll try to compensate in favor for that prior injury, but you don't want to re-injure it because that can almost be easier with a simple misstep.
For the ones that do frequent activities that causes injury, like cyclists, runners, sports players, they often know and can articulate when or why or how this injury occurred. But some people who don't perform these activities on a daily level do not know. Based on my training, I'd be able to tell somebody, hey, you have the specific foot structure that potentially can lead to these specific injuries. We also need to do this to either correct some pathology that this injury caused that you may be dealing with or prevent further injury.
For a lot of us, when we get an injury initially, unless it's really, really bad, we can dismiss it, put some ice on it, and keep on going. At what point should we probably come in? Because I suspect that the foot and ankle area can be tricky because there's a lot of little bones in there.
Anytime you can't do your activities of daily life, and that ranges from person to person. So some people may just need to get up, go to work, come back from work, go to sleep. So if you're more active, let's say you stand on your feet all day, or you're an athlete, these activities require a lot more of our feet and our ankles. And of course, if you start saying something like, hey, I'm starting to have a deformity, my foot looks different, my ankle looks different, then those are also be indications to go see a medical professional.
Yeah, because you all can do imaging and see what's really wrong and make sure that a little injury doesn't become a big injury. And of course, the great thing with you all is that there's a wide range of what you can do to fix it. Everything from sometimes it's just, you just need time. You just need to
Exactly.
take care of it in time to if you need surgery. You treat more than just sports injuries or those everyday injuries we talked about, heel pain, hammer toe, bunions, ingrown nails, and also for high-risk patients, diabetics, just getting a pedicure could result in an amputation or someone losing their life. So you all can take care of that in a safe way.
You know, we do a lot of preventative medicine, not just for sports medicine, but also higher risk patients, like you said, diabetics. And diabetics typically, the ones that do need intervention are the ones who have something called neuropathy, in which when neuropathy is where the nerves in your feet, especially your peripheral nerves in your feet and your hands, they don't act like they should based on your high sugar. So I do podiatry, foot and ankle. But as you can see, my group is Texas Heart and Vein. We are a multi-specialty group. So we have cardiovascular surgery here. We have peripheral vascular surgery. We have the interventional cardiologist. And all this works in the best way to help high-risk patients. Because patients with diabetes, as we know, they have heart issues, they have blood pressure issues, high cholesterol issues. So all these things need to be also addressed to have the best outcome for our patients.
And convenience is so good because, as you just mentioned, instead of going one place for one thing, another place for another thing, another place for another thing, it's all under one roof with you, with your network of doctors. Dr. Alabi, thank you very much. I'm going to go for a run, and then I'll be in just a few minutes.
Be safe. Be safe.
Got to be cute when you're running, right? Texas Heart and Vein Multispecialty Group has a special offer running through February and March. Get $100 off custom orthotics when you let their staff know you saw them on Great Day Houston. To schedule your appointment, call this number. It's 281-888-0809, 281-888-0809, or visit them online at thvmg.com.